So let's talk about bonding versus porcelain veneers. Here's a case where my patient had bondings and she was unhappy with her smile, but she really wasn't sure about wanting porcelain veneers because she was told that porcelain veneers could look and feel fake. And honestly, that's kind of a general comment from a lot of patients. When they come here, they are under the impression that bondings are better than porcelain veneers, which we disagree, obviously. We are known to create artificial teeth that look, feel, and function like real teeth. And I love doing cases like this where patients want natural, they want undetectable, and once they trust us and they allow us to deliver that, and we do deliver it, it's very rewarding. Anyway, so in this case, as you can see, our patient had bondings for several years. She had them replaced multiple times. She's done some patch-up work along the way, and she's starting to feel self-conscious and unhappy about the smile. As you can see, there's spacing, there is staining, there is chipping, and she's starting to feel like she's losing the original shape of her teeth. She's losing that, I guess, luster that natural teeth have. So once we discuss kind of what her wants are, what her wishes are, we discuss how we are going to remove the old bondings, kind of modify the teeth a little bit, and we're going to fit her into a custom set of temporaries where we could test drive essentially what the future smile looks like. We worked closely with the patient to establish what her original teeth look like and what type of shapes she was looking for. And what we had going on for us in this case was essentially the teeth were all in the right place, which meant that after removing the bondings, there was not a whole lot of tooth preparation was needed. She comes back, obviously this is a set of temporaries that she left with, and she comes back the following day so we could discuss her likes, dislikes, her concerns, our concerns. Did we follow the right design? Does everything kind of flow right in her face? Are the proportions correct? Are the angles kind of matching the facial muscles and angles? And from there, we take another set of x-rays, pictures, and scans, and we kind of transfer all that information to our lab. And our ceramist, Chris, as you can see, here's a model work. He was able to, get rid of that. He was able to recreate essentially the natural shape of her teeth. He built in some translucency on the incisal third, beautiful layering of colors, and finish it with some gingival warmth on the cervical area and then also interproximal area, which adds to its naturalness. From there, I think this is the side profile of the photo. Here's her finals, I think a day or two after insert. And as you can see, these teeth are super natural, and I want to say undetectable if you didn't know she got work done. Here's a transition from upper teeth that are veneers to our lower natural teeth, and we wanted to make sure we stayed within the same color scheme, and I think it was wonderfully done by Chris. Here's a close-up view of the retracted, and you can kind of see all the line angles, how they reflect light. The trick was by closing spaces, we didn't want the teeth to look bigger than her original. So placing these line angles in the right places, the embrasures, opening them up, kind of gave her that youthful look that she was looking for without it looking fake. And I think it's safe to say these are very nice, natural, and undetectable. The challenge here was, first of all, when a patient has a set of expectation, which for her was recreating her original shape of her teeth, we had to really work with her to understand what that meant, because if you look at her original, she's starting to lose the actual shape of these teeth, and there was a little patch-up work here, a little bit here, so the proportions were getting off a little bit. So she brought in some old photos, and we looked at them with Chris, and we recreated what we thought was her original teeth. Like I said, most of the teeth were placed in they're positioned in the right place in her mouth and also in her face. So we were just needed to tweak a little bit. She was in temporaries. We decided that I wanted to tilt this tooth a little bit more slanted. We wanted to bring this guy in and bring this guy out, but overall it was pretty smooth. And the most important thing was she was very worried about this side profile because she obviously didn't like her original side profile, which was this. So going from here to this, and then improvement to that is kind of what we accomplished. So I think her forefront teeth had a lot of bonding along the way. So she had them done multiple times, and I think the last few times she didn't replace the whole thing, so the previous dentist just almost did some patch-up work, which maybe looked good for a few days, but after that, as you can see, just they lose their luster, so there's no vitality on them. Obviously, you know, they're prone to stain. Not a whole lot of grinding was required. Obviously the forefront teeth maybe a little bit more because we had to remove all the old bondings, but these are all her own natural teeth. She had a little bit of bonding on these sides, but once we cleaned up all the old bondings, a lot of her old tooth structure was preserved and porcelain veneers were added on top of those. So overall, I think it was a very conservative case and very great natural results.